stimulates new cell growth and cell turnover. Do you feel the touch?
Yeah.
So the growth factors that we're after are down here in the layer that's closer to the red cells, but not the red cells. And then as we get to the top, it's less rich in platelets and more albumin, just more protein, which doesn't really have the growth factors we're looking for. To deliver the growth factors to the under eye area to rejuvenate it, we're gonna cleanse. So you can tell that the area that we want to add volume to, that's already filling in as comparative to this area. This is not going to be a lasting treatment in terms of volume fill, but it is rejuvenative and it will continue to get better, improve this area. We're using a cannula, it's not sharp, a lot less chances of penetrating inside a vessel, so that we're able to be right under the eye, staying in the orbital rim, changing trajectory towards lateral part of the under eye. That's perfect. So now we can tell how much more that's filled in. Part in here, and that's what we're reaching for. And we're just gonna get a tiny bit, and we're gonna use this part to fill the little scars, the pock marks that Allie has on her face from acne scarring, I assume. Here the areas of deficit is and what we want healed. And we're gonna inject where the little scar marks are. Fill that in. So that just really fills the tissues from within. The under eye area and all the scars. Now we start the microneedling process by applying a little bit of the PRF, setting that aside. Now that we're done filling the under eye and the scarring, we're gonna do the actual microneedling. How do you feel?
Good.
Does this hurt?
No, kind of tickles.
We're not looking to make the tissue bleed profusely. Pinpoint bleeding is normal, and the level of injury that we're wanting. We want a level of injury because that's going to set off the healing cascade. So this kind of a pinpoint bleeding is what we're looking for in a safe, effective treatment. What we use is called Skin Pen, FDA approved, top microneedling device. This is having the needles come out at its most. We hardly ever need to go all the way to 2. Sometimes we do over scars, closer to 1.5 or between 1.5 and 2. But on the more sensitive areas, on the under eye, we stay at half over eye. So the under eye area has the thinnest skin. The purpose for doing microneedling on that area is to toughen up and thicken up the skin. So ignoring the under eye would be doing a great disservice to your client. Now we do need to come way down on the intensity, and by pulling the tissue down, we can get pretty close to the lash line, support that area. So now that we've injected PRF underneath, and now we're saturating the area from the top and the bottom. The under tissue is already filled with PRF, so we've made sort of a sandwich with it. And now this level of micro-injury is going to thicken up the skin in this area. And what that will do is help with the dark circles. Now we're going to increase the intensity and really focus on the scar marks that we have on the face that we've identified, and I know where they are because we've injected them. So we can go up. When we're doing this on soft tissue, the intensity can be and should be increased. And then we just kind of stay on the scar. And the patient's still numb, so they should be pretty comfortable still. So we just stay on the scar and really focus on those depressions, and they do tend to bleed a little bit more, which is okay. And then move on. Always go all the way neck and décolleté. We never skip those parts, and that's because we want everything to be anti-aging at the same time. Some people really neglect their neck, and necks are difficult to correct as the years go by. So Allie is in her 20s, and it's a perfect time to start doing these sorts of facials just to stay young and prevent the aging process. A bit of PRF that we have left over, we rub it into the tissues. The level of redness is pretty typical for this procedure. This redness stays for about 2 days. So today Allie's going to be pretty red. By tomorrow, the redness is going to get better. And on the 3rd day, it's going to be almost all gone. By day 5, most people report that they have no more redness at all. In terms of aftercare, we will give you aftercare to use today. The most important thing is don't wash your face on the day that you get your microneedling with PRP done. You would be washing your face tomorrow morning and then applying your skincare routine. I personally like is the Revision line. This is a skin boosting serum that's great to put on the next day. On the day of microneedling, you can use vitamin C the next day after microneedling, so that would be a day like tomorrow. And this would be the moisturizer that would be appropriate to use on the next day after microneedling. Best thing you can put on is this daily boosting serum. That's a daily serum that we recommend to use. For older clients who have neck concerns, Nectafirm is a great product to use as well. Can also be used on the next day after microneedling. Some people know their skin and they're willing to, they know they don't react, so they're happy to use some of the stuff even on the day that they microneedle. The safest thing to do would be to use the hydrating serum on the day of microneedling and then proceed with a good skincare professional line for the following day, because the skin is kind of open to receive nutrients and vitamins. The DEJ stands for dermal epidermal junction. It penetrates deep. It's healing. We get really great results with people using the daily boosting serum on the next day after their microneedling. If they have specific under eye concerns, this is the Revox Line Relaxer by Revision. We use that pretty regularly with wonderful results.